Let's talk about diphtheria and the outbreak we've seen in the past couple of months, as well as the primary healthcare in Nigeria. I'm joined now by the Executive Director and the Chief Executive Officer of the National Primary Healthcare Development Agency. He served as the Incident Manager of the Nigeria Ebola Emergency Operations Center during the July to October 2014 outbreak of Ebola virus disease. Dr. Fasha Shuaib, thank you so much for talking to us on the program this evening.
Yeah, good evening, viewers, and thank you for having me over.
All right, let's begin with an update on the diphtheria figures as at today. What are the numbers as regards confirmed and suspected cases as well as casualties?
So as of today, on the national scale, we have reported a little over 14,000 suspected cases of diphtheria in Nigeria. Of this number, a little over 600 casualties. Most of these cases, of course, are in the states of Kano, which is the epicenter of the outbreak, Yobe, Borno, Katsina, Kaduna, and Bauchi states. These states are responsible for more than 97% of the cases in Nigeria.
I'm wondering what makes these states, particularly Kano that you mentioned as the epicenter, susceptible to this disease.
It's really come down to the low population immunity that is a direct result of poor suboptimal routine immunization among kids. This is something that is historical. So when you look at the data, most of the kids that are affected are aged from 5 years to 14 years. So what it tells you is that the low routine immunization is historical and has been here from the last 5 years to 14 years. So within the last 5 years, the routine immunization coverage has improved. That is why you find that fewer kids are affected by the diphtheria outbreak. But as from 6 years and above, between 6 years and the last 14 years, that's where you see that historical low vaccination coverage have made these kids very vulnerable. To describe this very carefully means in 2016, 2017, when there was a national survey of diphtheria coverage, for example, only 33% of kids nationwide had been vaccinated with the diphtheria-containing antigen. And when this vaccination coverage was repeated about 5 years later, this coverage had actually increased to first 70% in 2019 and then 57% in 2021. The dip was because of the outbreak of COVID-19. And we understand that this prevented parents from taking kids to have their regular shots in the health facilities. And of course, there was that general apprehension. People didn't want to go to the health facilities because they were afraid they would contract COVID-19. So what we have is a situation where historically low vaccination coverage in these affected states was now compounded by the COVID-19 vaccine lockdown and outbreak pandemic in the last few years.
I believe there's also the public knowledge gap, particularly the level of misinformation when it comes to vaccination aftermath the outbreak. I mean, the COVID-19 era. Some would say that with vaccination comes sterilization or what have you. How well are you dealing with that?
Yes, you're right. So in terms of why we have the low vaccination coverage in the first place, it is because of low awareness, low suboptimal knowledge about the importance of routine immunization. So in a lot of these communities, what we've found out is that parents are not aware that it is important for them to take their kids for vaccinations, right? And even if they are aware, there are misconceptions about the side effects of vaccinations. Of course, vaccines do have some side effects because when you give somebody a vaccine, the actual work of protecting the individual can have effects such as mild fever, right? So because what you are using to actually vaccinate the kids is an attenuated, a somewhat reduced in virulence. So to put it in layman terms, so what these vaccines contain are a form of the virus or bacteria that do not have the same power to cause disease. And because they don't have the same power to cause disease, the body is able to mount a response that kills them. And then for those that are already dead, next time the real bacteria or the real viruses actually attack the body already has memory about this is a similar virus, a similar particle that I know how to deal with. So that's pretty much how vaccines work. And we know that vaccines are the most powerful tool that we have in public health. In the last few years, we've seen how misinformation and disinformation, especially around COVID-19, has reduced the tendency and attitude towards accepting vaccines. So we recognize that people do not have knowledge about the correct information about vaccines. And instead of fighting them or ridiculing such people that do not have the knowledge, it is our responsibility as scientists to put this information in front of Nigerians. This is why the collaboration that exists between our agency, the Federal Ministry of Health, and the media is very, very critical in making sure that the correct information gets to Nigerians so that Nigerians can make an informed decision.
I know that some work is now being done to ensure high population immunity through vaccination. Like you said, quite a number of those children who contracted diphtheria never received routine childhood immunization, so to speak. But you also were quoted that to have said that inoculations will be mandatory, taking into account some public concerns. Are you in a way suggesting that children will be forced to receive these vaccines against the will of their parents?
I'm not sure putting that from. It is not the principle or the strategy of the Federal Ministry of Health and the National Primary Healthcare Development Agency to make vaccines mandatory. Like I mentioned earlier, it is our responsibility to work with traditional leaders, religious leaders, community-based organizations, political and opinion leaders to put the information, the correct information about vaccines in front of Nigerians. And I know Nigerians, the average Nigerian is very smart. And when they have information, they usually will take the right decisions about the vaccines. And those decisions are left, at the behest of the parents, of our leaders. It's just that in the last few years, thanks to social media, the permeation of the internet, people are getting information that is very, very contrary to the facts. So, for example, in the United States, if you observe during the COVID-19 pandemic, it was almost a straightforward tussle between the Democrats that were in favor of vaccinations and, a small fraction of Republicans, conservative folks that did not want the vaccinations, right? And each group was churning out messages in favor of their position. Sometimes those videos find their way to our system, and people who do not understand the background, right, will take one position or the other, not knowing that sometimes the contexts are completely different. But in Nigeria, we have a responsible government. NAFDAC has approved all of the vaccines that we use. And we know that once Nigerians have the correct information, that they're going to take the vaccines. Nigerians have a different context where we listen to and respect our political leaders, our traditional and religious leaders. Our traditional leaders are the custodians of our culture. Just like we had earlier today, the meeting of the Northern Traditional Leaders Committee on Polio Eradication, routine immunization, and primary health care. These are the leaders that helped us to eradicate poliomyelitis from Nigeria, especially when we had challenges with people that were spreading misinformation about the polio vaccines. And we have taken this fight against diphtheria outbreak to them, and they are working with the government, working with our partners and and donors to make sure that Nigerians get the right information. And
hopefully it reflects the numbers, Dr. Schweib. We have a very short time, and I want to ask you quite a number of questions. Let's talk about the issue with wearing face masks, because quite a number of people have grown weary of face masks post-COVID. And we're hearing you say that governors of the states with confirmed cases might have to reintroduce the wearing of face masks at public gatherings. What does this aim to achieve?
Yes, that is exactly what I said. I talked about the need for also introduction of non-pharmaceutical interventions, right? The vaccine, the outbreak of diphtheria, is variable across the different states. And this is why we've left it at the behest of the state governors to again implement the use of face masks, because just like COVID-19, diphtheria is an airborne infection. It can be transmitted when people cough, when people sneeze, right? So it has similar ways of actually protecting yourself from the next person that might be infected. And it does make sense that you protect yourself with the face mask. The evidence is there since 1918 when these studies were conducted, and then there are also clinical studies that have been conducted that show that just by wearing this face mask, you can reduce the possibility of getting infected by up to 95%.
I hear you, but you also agree that there's an economic dimension to it now. I hope you're planning to distribute the masks free to everyone.
So already we're seeing across the states that we've been to in the last couple of days. We've been to Borno, we've been to Yobe, we've been to Jigawa, Kano, and Kaduna states, and we're seeing how the states are coming in support of the health workers, people in the front lines, right? So there's still a stock of face masks that are in the stores from our days of fighting COVID-19. So those masks are being pulled out. They're being given to parents that are taking care of kids with diphtheria. And then in some of the schools, they're handing out these face masks because they are available. Of course, one thing that has happened thanks to COVID-19 is that even locally, we've ramped up our ability to produce face masks. So they're not as expensive as, in the beginning of COVID-19.
So you talked about ramping up vaccination earlier and the need to get more people to accept it. But there's reportedly a worldwide shortage of life-saving diphtheria antitoxin used in treatment of this disease. Does that affect Nigeria in any way? Do we have enough?
No, you're absolutely right that there's a shortage, of the diphtheria antitoxin, because Nigeria is not the only country that has an outbreak of diphtheria. But one thing that we have done is to ration the utilization of the available diphtheria antitoxin. We're working with our partners, and we've just received word that we're getting additional doses of the diphtheria antitoxin. So we're leaving the diphtheria antitoxin to those cases that are very severe, that actually require them. Apart from the diphtheria antitoxin, we also have antibiotics, microlides, that we use for the treatment of diphtheria. And in a lot of cases, the antibiotics and supportive therapy is able to get people over the hump in terms of recovering from the disease. And it's only in a few cases that you actually need to use the diphtheria antitoxin. Clearly, because of our networks and our long-standing relationships with our partners, every effort is being put in place to make sure that we get additional doses of the diphtheria antitoxin.
But this vaccination is free, right?
Absolutely.
All right.
Absolutely. Vaccination in Nigeria is free. And with the diphtheria outbreak, as well, we're giving the diphtheria a pentavalent vaccine and the TD vaccine for those that are, 4 years and above. We're giving it completely free.
We're also hearing about cholera outbreak. Is there any relationship between the two?
Well, the relation, of course, there are two different organisms, right? The diphtheria is caused by Corynebacterium, while the cholera is caused by Vibrio cholerae, two different organisms, but the perhaps underlying commonality between the two outbreaks will be the environment, right? These types of outbreaks are likely to happen where there is poor water and environmental sanitation. But of course, cholera is more of a waterborne disease. So it is by, drinking contaminated water that you get cholera, while on the other hand, diphtheria is more of an airborne disease.
Cholera probably speaks more to the absence of sustainable water sanitation and hygiene. Where's government failing in this regard?
Well, you can see that President Bola Ahmed Tinubu has been very clear in his renewed hope agenda that diseases like cholera that occur in epidemic proportions are going to be a focus by the provision of potable water supply, making sure that there's improved access to potable water supply, and then the reduction in environmental defecation and making sure that people also observe personal hygiene. This is where health promotion is very, very key, and something that the Federal Ministry of Health through the National Primary Healthcare Development Agency is working with the sub-national level state primary healthcare agencies to make sure that people have knowledge about the clear connection about poor hygiene and the incidence of such diseases. Right now, we have community health influencers and promoters that we're rolling out in communities that go house to house to educate householders about personal hygiene and environmental hygiene, and of course, the tips that they must take and utilize when it comes to how they manage water supply.
In the face of all of this, is the question, one critical question that has been raised is how equipped our primary healthcare centers have been across the country to respond to this outbreak. According to an independent investigation, less than 25% of primary healthcare facilities in the country are functioning. I'm wondering how much of this is contributing to the spread of infectious diseases and mortality rates that we're talking about.
Sorry, I think I lost you for a little bit there. Can you?
I'm asking how equipped our primary healthcare centers are in the face of this outbreak. According to an independent report, less than 25% of the primary healthcare facilities in the country are actually functioning. My question is, how much of this is contributing to the spread of the diseases and the mortality rate?
Yes, I'll assure you that the National Primary Healthcare Development Agency is the agency that has been sharing all of this data, trying to make sure that governors, leaders at the subnational level are aware of the need to invest in primary healthcare. So the actual number is that only about 27% of primary healthcare centers have the requisite numbers of human resources. And then a smaller number have the right equipment. State governors, state governments need to invest in primary healthcare. And when you invest in primary healthcare, then you are solving the problem of up to 70% of your populace. And by investing in primary healthcare, you are better able to avert these types of outbreaks, but also when you are better prepared to contain them.
You talked about investment on the role of state governors. We have just about 1 minute, but we need to ask where the monies are going to, because there were plans by the previous administration to refurbish about 10,000 primary healthcare facilities across the country. We're hearing the current Minister of State saying 8,000 of them will be funded through the Basic Healthcare Provision Fund. I'm a little bit confused. I thought some monies were disbursed in this regard before.
Yes, what the coordinating minister of health was talking about is the basic healthcare provision fund. When we say 10,000 political words, that's approximately, 8,000. That is really the focus. The basic healthcare provision fund is only part of the resources that will be deployed to the primary healthcare centers. We have over 7,000 primary healthcare centers that are already getting about 300,000 naira every quarter to improve infrastructure, to hire midwives, for their work, but that is not enough. State government also have to contribute. This is why they also the 2014 Health Act provides for state governments to provide up to 25% of whatever they get from the basic healthcare provision fund. But a lot of states really have not made that contribution, and we're hoping that with the current administration, that states will invest more in primary healthcare. This is exactly what the coordinating minister of health and social welfare is trying to do, to mobilize the resources and deliver on primary health care.
Executive director, so we use a lot of editors here. I beg your pardon. Chief Executive Officer, National Primary Healthcare Development Agency, Dr. Pfizer. Thank you so much for talking to us on the program this evening.
Thank you for having me.